I've been involved in conducting research on the health impacts of paid sick days since 2006 and have co-authored 2 comprehensive health impact assessments of the paid sick days legislation. Almost all the data and evidence I've reviewed is consistent with the premise that a requirement for paid sick days would protect the health of all Americans. I want to articulate a few facts with this regard for the committee's interest. First, I think it's important to note that workers with paid sick days are actually more likely to take time off work when they're ill. We know that a number of studies have demonstrated this. We know that the average number of days missed from work for those with paid sick days is higher than those without paid sick days. I think it's important to note that this is the factor here is workers with paid sick days policies, not paid time off policies or other types of policies. A second important point is that these workers are not taking time off sick not because they're not sicker. The workers without paid sick days are actually sicker and have more dependent and medical needs. Workers without paid sick days are more likely to have a child with asthma, for example. Workers without paid sick days are also more likely to have a lack of health insurance. Low-income workers without paid sick days have vulnerability to environmental exposures and a whole set of other conditions. The second point is one that has been raised previously, is that effective strategies for influenza prevention require compliance with recommendations that keep workers and students home from sick, and paid sick days legislation would enable this compliance. As we know, about 5 to 20% of the population gets influenza every year, and about 36,000 people die. This is from seasonal influenza, not a pandemic. In a pandemic, the number of people suffering could reach 70% of the population, and the number of sick individuals could reach 100 million. As we've noted, 37% of the transmission of influenza occurs in community settings such as schools and workplaces, and 33% in additional community settings. We have modeled influenza spread and strategy and the effectiveness of strategies for prevention. We know that these strategies to keep people home from places they can communicate the disease can reduce influenza spread by 15 to 34% depending on the studies. Every one of those studies models a certain degree of compliance. It assumes that people actually will follow these rules. We don't have the enabling structures in our society to have people follow the rules, and that's why I think this bill is so important. This issue is important for communicable diseases other than influenza, the one that I think that everyone has been paying attention to recently. I think it's even more striking in the situation of foodborne illnesses. We have about 76 million foodborne illnesses every year, resulting in 325,000 hospitalizations every year. More than half of foodborne disease outbreaks, where you have 2 or more infections from a common food source, occur in restaurants. Food safety codes tell employers they have to exclude sick workers from workplaces when they're sick. However, we know this is not happening today. We as public health rely on voluntary compliance with these exclusion policies. Yet the data from the CDC will tell us that up to 14% of foodborne outbreaks are associated with a food worker who is sick and working. One study that looked at outbreaks involving food workers found that almost all of them were ill at the time of the outbreak. Each one of these outbreaks can be quite significant. In 2006, a restaurant worker without paid sick days infected over 350 customers with norovirus at a restaurant in Lansing, Michigan. The fourth point I want to make is that workers with paid sick days are more likely to take care of their children and dependents and ensure their regular contact with medical providers. For dependents, including children and elders, having access to an adult is more than a convenience. It can be a matter of life and death. Children left at home may be unable to see physicians for diagnosis. Children need to receive medicines or emergency help if their conditions worsen. The presence of parents at home can reduce hospital stays by 31%. Parents who have sick days are 5 times more likely to take care of their children. We know that families without paid sick days are more likely to experience delayed care for their children. In San Francisco, we adopted paid sick days in 2007. We are at the early phases of implementation. However, I think it's pretty clear from I regulate 6,000 food businesses. We have not had an outburst or issues from our businesses. Most of the businesses in San Francisco seem to be implementing this law without problem. Anecdotal evidence from business leaders suggests the same. I'm going to conclude. I think a fundamental purpose of government is to ensure the day-to-day living conditions are healthy. We need to remember that laws like labor laws are fundamentally public health laws. These were the laws that improved our life expectancy in the 20th century. And labor laws like paid sick days are still public health laws today. The U.S. spends over $6,000 per person per year on health care costs. Yet we are last in the world among our peers in life expectancy. Something is amiss. Most of the other countries that have good life expectancies have safety net policies like sick days that take care of people and prevent illness before they're sick. I think it's time for us to join that crowd. Thank you.